Let us continue with the C part of abdomen. Um, Let us be patient, have a lot of patience, right? And as you can with your words and incorporating the new words you're learning, review your material as you read your atlas. Um, a lot of people go and take photocopies or just copies, or they just draw, right? As this description, right, is done. Um, the arrangement of all these parts are evident, right? Objective, present, and you cannot miss the point. Some people go to the autopsies, right? They become volunteers in order to have experience in how to see the different colors the human bodies present, right? That a lot of people might have very red, brownish muscles. Some other people might have very rose, pale muscles. Some people might have pale beige, still mixed with some pinkish, reddish. It depends. The weight, right? Some are yellow, right? It depends. The age also. A lot of people they like to purchase a cadaver, right? And really there is no need to purchase a cadaver because the plastic dolls are very identical. A lot of people say, let us just go and purchase something that it looks like the human body, right? But then you go and you get very tired of touching and seeing how they look like, right? And it's just the same like you are having in your hands a chicken to be cooked or some steak or whatever, right? The same fascias, membranes, fat tissue is the same thing. And but I advise you to purchase the plastic dolls, right? So you can learn all your basics, right? And just get your basics out of the way. And because you're gonna be probably choosing the specialty, when you reach your specialty, you're gonna have plenty of chances to really work on your area of your expertise, the one that you want to become doctor, and that's how everything becomes very enjoyable. Right? We were saying last time that the ovaries also develop in the superior lumbar region of the posterior abdominal wall and migrate to the lateral wall of the pelvis. The processus vaginalis of the peritoneum transverses the transversalis fascia at the side of the deep inguinal ring, forming the inguinal canal as in the male, protruding into the developing labius majus. The gubernaculum, a fibrous cord connecting the ovary and primordial uterus to the developing labius majus, has the following adult derivatives. The ovarian ligament between the ovary and the uterus, the round ligament between the uterus and the labium majus. Because of the attachments of the ovarian ligaments to the uterus, the ovaries It says over here that do not descend to the inguinal region, and therefore, or however, the round ligament passes through the inguinal canal and attaches to the subcutaneous tissue of the labrum majors. The processus vaginalis usually disappear by the 6th month of fetal development. For a review of this, take a look at your embryology book. If you have embryology atlas, it will be great. Or the female genital tract, right? The inguinal canal in females are narrower than those in males, and the canal in infants of both sexes are shorter and much less oblique than in adults. The superficial inguinal ring in infants lie almost directly anterior to the deep inguinal ring. Increased intra-abdominal pressure, the deep and superficial inguinal ring in the adults do not overlap because of the oblique path of the inguinal canal and increases intra-abdominal pressure act on the inguinal canal, forcing the posterior wall of canal against the anterior wall and strengthening the wall, decreasing the likelihood of herniation until pressure overcomes resistant effect of this mechanism. Contractions externally of the external oblique approximates the anterior wall of the canal to the posterior wall. Contractions of the internal oblique and transverse abdominal muscle makes the roof of the canal descend, constricting the canal. The spermatic cord suspends the testes in the scrotum and contains structures running to and from the testes. Take a look in your atlas, this spermatic cord. Begin at the deep inguinal ring lateral to the inferior epigastric vessel. Passes through the inguinal canal, exits at the superficial inguinal ring, ends in the scrotum at the posterior border of the testes. The spermatic cord is surrounded by fascia covering derived from the anterolateral abdominal wall during prenatal development. Let us check and double check with the books that we already been learning, right? All this information is very interesting. Internal spermatic fascia derived from the transverse fascia. Cremasteric fascia derived from the fascia of both the superficial and deep surfaces of the internal oblique muscle. The external spermatic fascia is derived from the external oblique aponeurosis. The cremasteric fascia contains loop of the cremaster muscle, which is formed by the lowermost fascicles of the internal oblique muscle arising from the inguinal ligament. The cremaster muscle reflexively draws the testis superiorly in the scrotum. When it's cold weather, in a warm environment such as a hot bath, the cremaster relaxes and the testis descends, regulate the temperature of the testis for spermatogenesis, which we know that is how the cycle of the sperm formation, which requires a constant temperature approximately 1 degree cooler than the core temperature. The cremaster is innervated by the genital branch of the genitofemoral nerve, L1, L2, a derivative of the lumbar plexus. The constituents of the spermatic cord is duct deferens, a muscular tube approximately 45 centimeters long that conveys sperm from the epididymis to the ejaculatory duct. Testicular artery arising from the aorta and supplying the testes and epididymis. Arteries of the duct deferens arising from the inferior vesical artery. Cremasteric artery arising from the inferior epigastric artery. Pampiniform plexus advenous network formed by up to 12 veins draining into the right or left testicular veins. Sympathetic nerve fibers on arteries and sympathetic and parasympathetic nerve fibers on the duct deferens. Genital branch of the genitofemoral nerve supplying the cremaster muscle. Lymphatic vessels draining the testes and closely associated structures and passing to the lumbar lymph nodes. The scrotum is a cutaneous sac consisting of two layers, heavily pigmented skin and the closely related dartos fascia, a layer of smooth muscle fibers which is responsible for the rugose or wrinkled appearance of the scrotum. Because the dartos muscle is attached to the skin, the contractions causes the scrotum to wrinkle when pulled, which helps to regulate the loss of heat through the skin. The scrotum is divided internally by the septum of the scrotum into right and left compartments, and externally by the scrotography, a cutaneous ridge marking the line of fusion of embryonic labioscrotal swelling. The superficial dartos fascia of the scrotum is devoid of fat and is continuous anteriorly with a membranous layer of subcutaneous tissue, right? Which is called the Scarpa's fascia, also is another name that receives it, of the anterolateral abdominal wall and posteriorly with the subcutaneous tissue of the perineum, right? The development of the scrotum is closely related to the formation of the inguinal canals. The scrotum develops from the labioscrotal swellings. Two cutaneous outpouchings of the anterior abdominal wall that fuse to form a pendulous cutaneous pouch, the scrotum. Right. The arterial supply of the scrotum is it comes from perineal branch of internal pudendal artery and forms posterior scrotal arteries. The external pudendal branches of the femoral artery that forms the anterior scrotal arteries. The cremasteric branch of the inferior epigastric artery. The scrotal veins accompany the arteries. The lymphatic vessels of the scrotum drain into the superficial inguinal lymph nodes. The nerves of the scrotum are the genital branch of the genitofemoral nerve L1, L2, supplying the anterolateral surface of the scrotum. Anterior scrotal nerves branches of the ilioinguinal nerve L1 supplying the anterior surface of the scrotum. Posterior scrotal nerves branches of the perineal branch of the pudendal nerve S2 through S4 supplying the posterior surface of the scrotum. Perineal branches of the posterior femoral cutaneous nerve, supplying the inferior surface of the scrotum. The epididymis formed by a little convolutions of ducts of the epididymis, and a very tightly compacted, they appear solid. The epididymis lies on the posterior surface of testes, covered by tunica vaginalis except posteriorly margin. The convoluted duct of the epididymis becomes progressively smaller, passing from the head of epididymis on the superior part of the testis to its tail. The ducts deferens or deferens ducts begin at the tail of epididymis, at the continuation of the epididymal duct or duct of the epididymis. The efferents ductless transport the sperm from the root testis, which is a net, right? The L dot read a net, right? To the epididymis where they are stored. The red testis is a network of canals at the termination of the straight tubules, which are the seminiferous tubules. And the epididymis consists of a head, a body, and a tail. A head, which is superior expanded part, composed of lobules formed by coiled ends, or 12 to 14 efferents ductus. A body that consists of the convoluted duct of the epididymis. A tail that is continuous with the ducts deferens, the duct that transports sperm from the epididymis to the ejaculatory duct for expulsion into the prostatic part of the urethra. Take a look in your atlas, all these details and all these parts, right? So you can get familiar with it, right? The testis, right, is an ovoid organ that is suspended in the scrotum by the spermatic cord. The left testis is suspended more inferiorly than the right and are covered with a tough fibrous coat, the tunica albuginea. The testis produce sperms. The hormones, principally testosterone. The sperms are formed in the long convoluted seminiferous tubules that are joined by straight tubules to the root testis. The surface of each testis is covered by the visceral layer of the tunica vaginalis, with exceptions where the testis attaches to the epididymis and spermatic cord. The tunica vaginalis is a closed peritoneal sac partially surrounding the testis, which represents the closed-off distal part of the embryonic processus vaginalis. The visceral layer of the tunica vaginalis is closely applied to the testis epididymis and the inferior part of the ductus deferens. The split-like recess of the tunica vaginalis, the sinus of the epididymis, is between the body of the epididymis and the posterolateral surface of the testis. The parietal layer of the tunica vaginalis adjacent to the internal spermatic fascia is more extensive than the visceral layer and extends superiorly for a short distance into distal part of the spermatic cord. The small amount of fluid in the